This is Decision 2010. Tonight, a debate for the U.S. Senate. And now,
You said the first thing you'll do if elected is work to repeal the health care reform bill, or Obamacare, as its detractors call it. You said it will ruin the best health care system the world has known. But the U.S., despite having the world's most expensive health care, ranks behind a number of other nations on measures like infant mortality and life expectancy. So my question is, how do you propose to remedy those kinds of issues and the fact that there are more than 50 million Americans uninsured?
Well, let me first ask the obvious question. What are the poor Canadians going to do when this health care bill is fully implemented? Where are they going to go for their health care? Because they're coming here to get it now. Socialized medicine has never worked where it's been tried, and this is a road to socialized medicine. Let's go back and look at the promises here. Health insurance premiums will come down. They are skyrocketing. We were told it would not require any new taxes on the middle class. They're going up. We were told it wouldn't require new deficit spending. And the question becomes, can we afford a new entitlement that costs this kind of money? And my point would be that there are better ways to reform health care and provide it to people who do not have it than the way it was done. I also object to the way it was done. Rammed through in the middle of the night. I'm willing to bet not a single senator read the 1,900-page bill before they voted for it.
So what are some ways we could get insurance to those uninsured?
Bobby, I think you ought to be able to buy an insurance policy in Pennsylvania if you think it would be better than the one that you buy in New York. I believe all of us should be able to shop across state lines. I believe that small business people should have the same status as those who work for large corporations in tax treatment and deductibility. I believe that all small business people should be able to band together, to pool, so that they have the leverage to negotiate with insurance policies. Why? They never put tort reform in this bill to stop some of these junk lawsuits that drive up the cost of medicine. It's beyond me.
Mr. Schumer, you were instrumental in getting legislation passed. Is it working?
Well, it will work. It hasn't really gone into effect yet. Very small pieces have. But let's not forget two things. First, before the health care bill was ever a gleam in anyone's eye, there were huge complaints about our system. Premiums going up, people not getting covered. Every day someone would call my office and say, my daughter has a serious illness. I have an insurance policy, but somehow the insurance company is wriggling out of it because I didn't dot an I or cross a T. The health care bill improves much in the system. First, there are some things that are happening right now. That insurance company can't get out of the contract if the dot, if they say the I wasn't dotted. If you're 23 years old, just out of college, you have a job that doesn't give you health care insurance, you can go on your parents. That's a good thing. But the number one thing that Bill is going to do in 2014 when the exchanges start is finally get a hold on the increasing costs. The premiums that go up and up. It is estimated that premiums will go down 20% once there's competition among the insurance companies in the exchange. Right now, there's very little competition, and that's why premiums keep going up and up.
All right. Mr. Townsend, what about some of those benefits?
Oh, I love all of these promises that we hear. Just be patient, just be wait. We were wrong about the rising premiums. We were wrong about the taxes. We were wrong about the deficit spending required. But hang around until 2014 and it will all be better. I'm sick of these empty promises from the Obama administration. I'm sick and tired of the excuses why something that was passed didn't work out like it was promised.